How do otoacoustic emissions, OAEs tests work? Imagine your inner ear having its own tiny echo chamber. That's essentially what otoacoustic emissions tests explore. They measure sounds that your cochlea, the hearing part of your inner ear, produces naturally. These sounds are called otoacoustic emissions and are created when the outer hair cells in the cochlea respond to sounds. When soft clicking noises or tones are played into your ear, these outer hair cells vibrate and generate faint echoes. These echoes then travel back through the middle ear to the ear canal. A small probe is gently placed into your ear canal during the test. This probe delivers the soft sounds and contains a sensitive microphone that listens for the tiny echoes bouncing back. The process is quick, usually taking just a few minutes, and it's completely painless. You simply need to stay still and quiet while the test runs. The microphone captures the echoes, and the device analyzes them by averaging responses to filter out background noise. This helps determine how well the outer hair cells in your cochlea are functioning across different frequencies. There are two main types of otoacoustic emissions tests. One is called transient evoked otoacoustic emissions, which uses brief clicks to stimulate the ear. The other is distortion product otoacoustic emissions, which uses two tones played at the same time. The cochlea responds by producing emissions at specific frequencies related to the tones, giving detailed information about cochlear health. Both tests are objective, meaning they don't rely on your responses, making them especially useful for testing babies, infants, or anyone who can't give reliable behavioral responses. If the test detects emissions, it generally indicates that the outer hair cells and cochlear function are normal or near normal. If emissions are absent, it could suggest hearing loss or middle ear issues like fluid buildup or blockage. This doesn't give a complete diagnosis but points to whether further testing is needed. Otoacoustic emissions testing is a vital part of hearing screening programs, especially for newborns and young children, because it can quickly identify potential hearing problems early on. In summary, otoacoustic emissions tests work by playing soft sounds into the ear, listening for the tiny echoes produced by the cochlea's outer hair cells, and analyzing these echoes to assess hearing health. This method provides an objective, fast, and non-invasive way to check if the cochlea is working properly, making it an essential tool in hearing screening and diagnosis. Always remember, if you have concerns about hearing, consult a healthcare professional for personalized advice and further evaluation.